like to welcome representatives from the Queensland Council of Social Service. Good morning. I'd like you to make an opening statement of around 5 minutes, and after that we'll ask you some questions.
Thank you. Good morning, everyone. I'd like to start by acknowledging the traditional custodians on the land on which we gather today, the Jagera and Turrbal people, and pay my respects to elders past and present. My name's Bronwyn Kippen and I'm the Housing Campaign Coordinator at QCOSS, and I'm here with my colleague Ryan. We'd like to also thank the committee for the opportunity to speak this morning, and we acknowledge the important work of the committee and that of the public advocate in providing the safe, secure, affordable report. QCOSS supports the inquiry's goals of considering the appropriateness of supported accommodation in Queensland. QCOSS is the peak body for social service sector in Queensland. Our vision is to achieve equality, opportunity and wellbeing for all Queenslanders. With more than 300 member organisations across Queensland, QCOSS receives extensive feedback on the impact of the housing crisis is having on our communities, service delivery and also workforce sustainability. Queensland's current housing crisis has laid bare the vulnerabilities that exist in the housing system. Our frontline services are currently witnessing distressing levels of housing need and the human impacts of the same. The Paulson report last year found that over 150,000 households in Queensland have an unmet need for social and affordable housing, and over 7,000 people in Queensland are living in supported accommodation at the moment. For many people, it's an option of last resort and only becomes a person's residence due to a lack of alternative housing or supports. And this lack of appropriate housing includes a significant undersupply of social housing, with over 25,000 households currently waiting for social housing in Queensland. People living in supported accommodation almost always have low incomes and can experience a combination of physical and mental health issues, intellectual disability and or substance use. This increases the support and wellbeing needs and heightens the risk of abuse and neglect and exploitation being experienced. The current regulatory framework and delivery approach do not adequately protect people's rights or support individual wellbeing. The regulatory framework for supported accommodation, including levels 1, 2 and 3, must be reformed using a human rights-based, person-centred approach to design reform measures that respect and protect rights and to support people to maintain wellbeing and to achieve goals. The Queensland Government must invest in housing to ensure people have access to homes that are community-based, meet minimum standards and are appropriate for the person's needs. This should include investment in public and community housing. The Queensland Government must also invest in a review of the supported accommodation service delivery model with a view of transitioning to an evidence-based, person-centred housing first approach. This transition must include investment to undertake a comprehensive assessment of people's needs and their goals, to establish permanent supportive housing solutions, to provide independent case management support, and also to increase investment in delivery of psychosocial supports. In addition to the above, which reflects our submission, QCOSS would also like to express support for the Human Rights Commission's recommendation to consider whether residential services should be public entities under the Human Rights Act, also the Public Advocate and Queenslanders with a Disability Network's recommendation to establish safeguarding framework, and lastly, specific rooming and tenancy reforms outlined in Tenants Queensland's submission to improve rooming and renter rights. In conclusion, the regulation and provision of supported accommodation must be reformed to provide safe, secure, appropriate housing and support services that foster wellbeing and achievement of goals. Thank you.
Thank you, Ms Kippen. Would you like Mr Ryan to say anything further to that?
No.
Sorry, Mr O'Leary, sorry. No? Okay, all right. I'll hand over to the Deputy Chair.
Thanks. Good morning. In, say, Northern Territory or New South Wales, because some of the evidence we gathered this week where people are being referred from interstate due to reforms that have happened in other states.
I'm not aware of the specific details of those, but I think the reason why, well, I know the reason why from our perspective we're recommending regulatory reforms is that overwhelming the feedback was consistent from our members that the current system really isn't working for the people that are living in supported accommodation. And the framework that exists now is not supporting people's wellbeing and needs, and we need to transition to a contemporary person-centred, evidence-based approach for supporting people in the community.
Sure. Just a quick follow-up. Get observation of statistics is a wonderful thing, but during this week of travelling, I guess I overwhelmingly probably saw more people that were very content with their arrangements and would probably have a lot of difficulty with what's been already presented as evidence this morning about transitioning and a lot of other things. So how would you think we should go ahead making recommendations about those people that are very content in their current environments? It was important to acknowledge that, as was said earlier, that there is a broad spectrum of supported accommodation providers, and some people, as you say, are very happy living in supported accommodation. We have had that feedback through our members. I think one of the key recommendations that we made is that a starting point for reforms should be to really understand people that are living in supported accommodations, what they want and what their needs are. At the moment, there's not a real, a comprehensive picture or understanding of that. I think, as we've heard from previous people are in supported accommodation almost by default because there aren't other housing solutions and support services available. We've recommended that any sort of reform process really needs to start with the people living in supported accommodation and maybe using supported accommodation in the future. And any design of the reforms should incorporate co-design with the people that will be living in supported accommodation or whatever model is in the future. Thanks, Chair. Yep.
Okay, I'll move to the member for Cook.
Thank you, Chair. Thank you, Bronwyn, this morning for your time. You recommend reforms to strengthen rights such as rooming and tenancy rights. Specifically, what would you like to see changed?
Yeah, some of the feedback that we had, particularly around in boarding house environments, is that there's a real lack of privacy and security, and also in terms of really short-term evictions, people can be immediately evicted from their property if they've been deemed by the landlord to there's not a lot of grounds are required to have to be evicted. And in the boarding room situations, people can be asked to immediately leave and there's essentially nowhere for them to go. So they're evicted into homelessness.
Member for Mayway.
Thanks, Chair. I appreciate your time this morning. Just to your recommendation around investment in a review of the delivery model and supported accommodation, and similar recommendations have been made by other organisations around a formal review of the statutory framework, the legislation. Who, in your view, would be, best positioned? Like, what do we need to look for in either an existing body or a new body to undertake that kind of review and to make recommendations? And I ask that against the backdrop of obviously both the Public Advocate's report and the recommendations that we undertake a parliamentary inquiry to answer that long list of questions from Dr. Chesterman. I guess I'm just looking for your guidance on, what the next step might be for review and, importantly, for that co-design that you've talked about.
I'm not able to suggest a specific body. I mean, at the earlier discussions I can point to in terms of establishing a separate body to then implement the changes. We would support that, but I'm not able to point to a specific body. I'm not sure. Ryan?
Yeah, I don't think we can in this conversation today point to a specific organisation, but I think ones that are able to have really robust processes that include the voice of lived experience and people that are living in these current accommodation settings, and ones that have a proven record of being able to facilitate that process of a review up to a high standard that holds that principle of being person-centred.
Okay. Look, I appreciate that. There isn't obviously a kind of ready-made organisation to do this kind of work, otherwise we might already see it being done. There is a bit of a history of punting sticky regulatory issues to the Law Reform Commission. Would they maybe play a role in further review, or is it is it not that kind of detailed, legalistic and regulatory review that should be the priority?
Look, I'm really not too sure. I think it'd have to have some oversight of a range of different perspectives and expertise. I think there would be organisations that have the capacity and capability to do it. It's just difficult, I think, as a peak body for the community service sector to name specific organisations.
Yeah, I appreciate that. Thank you.
Thank you. My question's to you, Ms. Kipling. In your opening statement, you mentioned a safeguarding framework. What would that look like in your view?
So the feedback from members was that essentially there wasn't enough safeguarding in place in terms of protecting people's rights and people being able to have advocacy, have feeling enabled to be able to advocate for their rights. So it would be really important, as was mentioned in the previous discussion, that there are people community representatives going in to visit people, to understand people's needs and to assist them with advocating and having those processes in place to protect people's rights.
Thank you for that. The member for Oodgeroo.
Good morning. In terms of regulatory environment, regulations around the service providers of different levels, do you think that level 1 and level 2 providers, do you think that we need to strengthen regulations around those levels? If so, how? In terms of a comparison to level 3, do we need to bring them up to level 3, or what do you have any thoughts in that area?
Yeah, we're certainly, from the feedback from members, we're not saying that the same sort of regulation is required for all 3 levels of supported accommodation as they exist now. So, for example, through doing an assessment of people's needs and goals, you may find that some people living in level 1 supported accommodation could quite happily and want to live in social housing in the community with support being provided through, say, NDIS. And so obviously in that instance, the regulatory framework, it's actually, shifting. So they may not have the same regulatory framework because they're not actually in supported accommodation anymore. They're living in social housing with supports from other services. But as you move up to higher levels of need, potentially like the level 2 and level 3, as they are described now, then that would be where we would recommend, based on the feedback from our members, that the regulation be, increased and improved so that there's increased transparency. Sorry, I should have mentioned it before when you're asking about regulation, but introducing minimum standards for the care, minimum standards for the housing, having formalised complaints processes that are managed and transparent. All of these elements would contribute to regulating the people that require the higher levels of support and care, where they may be in something that some form of supported housing that is reflective of the level 2, level 3 that we think about now.
Thank you.
Okay, thank you. A question from the member for Burnett.
Thank you. Been watching in interest your submissions about housing and needs over a couple of years now. The housing first approach in your submission, would you extrapolate that out for the committee a little bit, please, and how you see that being a solution?
Yeah, we pointed to the housing first approach because it is a evidence-based approach that's been around for a long time now that prioritises housing first for people and prioritises permanent housing first. So in the overall kind of support and housing system at the moment, in a lot of instances, people are stuck in temporary or crisis accommodation, or to relate it to the inquiry at the moment, in supported accommodation. So the housing first approach is really about prioritising people being placed or choosing placed is the wrong terminology, people choosing a permanent and having access to permanent housing first, and then being supported by the necessary supports to be able to sustain that tenancy. So that's where it might be case management support that we've talked about in our submission and other people have, and it's informed by more contemporary practice that's person-centred, trauma-informed, and the goal is to enable people to have good wellbeing, support them to achieve their goals and to sustain their tenancy. It is an investment model that sometimes people might see as expensive, but actually some of the research demonstrates that long term it actually isn't that. It is cost effective because there's a lot of evidence to show that it reduces incidence of hospitalisations, interactions with police, for example, and also, constantly cycling through potentially crisis and temporary accommodation.
Thanks.
Okay, all right. Thank you. Our time's just about up, and I want to thank QCOSS for coming along today and being with us.